Welcome to the UVU PreHealth Online Orientation. This orientation is designed to provide detailed information about the requirements for different health professions careers, including medical, dental, pharmacy, physical therapy and occupational therapy, physician's assistant, optometry, podiatry, chiropractic, and vet. Health professions programs are highly competitive, and it is important for you to be familiar with the academic and extracurricular requirements early. It is recommended that you write down your questions as you go through the orientation so they can be answered when you meet with the pre-health professions advisor. There are several steps to becoming a healthcare professional. You need to complete a bachelor's degree as well as the prerequisite courses. Most students will complete these concurrently. Extracurricular activities and the admissions tests help you prepare to be a competitive applicant so you can apply and be accepted into a health professions school. The majority of health professions programs are 3 to 4 years in length, and some will require a residency after graduation. Some will have optional residencies available. Health professions schools expect applicants to have certain characteristics in order to be competitive. They will want to know if you have the academic and intellectual ability to handle the rigors of a health professions program. Do you have the appropriate motivation? You will need to explain to health professions schools why you want to go into that field. Liking science and helping people are good motivators. However, you should be able to explain why you want to help people through that specific profession. Schools will also want to know that you have the maturity necessary to take on the level of responsibility expected of you as a healthcare professional. Health professions schools do not require a specific bachelor's degree. You should be choosing a degree that is interesting to you and that will act as a plan B if you change your mind about a health professions career or do not get accepted. While you are here at UVU, you will have 2 advisors. Your major advisor will help you plan out the courses you need to graduate from UVU with your degree of choice. The pre-health advisor will help you prepare to move on to a health professions program after completing your degree. It is important to stay in contact with both advisors. There are different myths floating around about what kind of degree you should have. While biology is the most popular degree for students interested in a health professions career and will prepare you well, it is not required. Many students also hear that they should major in something other than biology to set themselves apart. The truth is that if you are counting on your degree to set you apart, you have not done enough. You will never be accepted or rejected by a health professions school because of the degree you choose. The degree you choose should be a reflection of who you are, not what you think someone else wants you to be. For students planning to go into physical therapy, the most common degree is exercise science because of the similar focus on athletics and how exercise affects the body. Pre-pharmacy students are not required to complete a bachelor's degree, but most students do plan to complete an associate's degree. Pre-professional is an appropriate AS degree to choose. Many of the prerequisite courses are similar for each healthcare profession, but there are often big differences. Prerequisite courses will vary for each profession, but they may also vary a great deal between schools within the same profession. It is recommended that you begin researching individual programs you may be interested in to ensure that you complete the requirements for your top choice schools. There will be additional information on how to do this later in the orientation. Note that science classes are more difficult than other general education and liberal arts courses, and you should plan at least 3 to 4 hours of study time for every hour you spend in class. Certain classes should not be taken together, so it is important to meet with the pre-health advisor to make sure you are planning a schedule that will be manageable. GPA is one of the most important areas of your application. How UVU calculates GPA is different from how health professions programs will calculate your GPA. All classes taken for college credit will be calculated into your GPA for health professions schools, where UVU is only concerned about your UVU GPA. It is important that you do well in your classes the first time around since they will all count. If you have struggled in college courses before and have done poorly in some of your classes, it does not necessarily exclude you from becoming competitive for health professions programs, but it is something you will want to discuss with the pre-health advisor to determine your best strategy. Although not the best fit for everybody, the honors program can be a good choice if you want to set yourself apart academically. Other ways to help you succeed in your classes are through the Peer Tutoring Center and study groups. Teaching others and learning from your peers are some of the best ways to do well. If you have any questions about the science classes you will be taking, you can contact Chris Lang. Chris is the student senator for the College of Science and Health and is a pre-med student who will be applying this coming summer. He has taken most of the classes required for the health professions program and is happy to talk to you about his experience at UVU. For new and returning students who have not taken college classes or who have taken only a few college classes, math and English are your top priorities. Math and English are the prerequisites for many of the science classes you will need. The pre-health advisor can help you plan a schedule for completing prerequisite courses related to the profession you are interested in, but you will also be meeting with the Career and Academic Counseling Center if you have not chosen a major yet, or with your major advisor if you have chosen a major. They can help you know which classes you need to complete to fulfill your general education and major requirements. If you are planning on serving an LDS mission and will only be taking 1 to 2 semesters of college before, you will not start your pre-health courses until after your mission. The things you learn in those courses will be important later when you are preparing for the admissions test and should be fresh in your memory. Unless you can complete at least Math 1050 before your mission, do not plan on taking any math courses until after you come home. The math department will require you to test into math after your mission. If you have only completed Math 1010, you may test into a lower class after not using math for 2 years, and you may need to start at a lower level than you were at before your mission. So it is better to wait than to have to repeat classes later. Transfer credits are not calculated into the UVU GPA. Health professions schools will include all courses you have taken for college credit, so you should be aware that your UVU GPA will never be an accurate depiction of your GPA for a health professions school. The GPA calculator is available on the UVU PreHealth website and can be used to calculate your GPA, including all courses taken. Post-baccalaureate students are students who have completed a bachelor's degree and are returning to school to take the prerequisites for a health professions program. Most post-baccalaureate students want to get through their classes as quickly as possible, but it is important to be aware that on average it will take about 2 years to complete the prerequisite courses and be prepared to apply to health professions schools. Some courses need to go in a certain order and cannot be sped up. Your schedule will depend on the degree you have completed and previous courses you have taken. A strong GPA and admissions test score give health professions schools a reason to look more closely at your application, but it does not set you apart. GPA and test scores show that you have the academic ability to handle a health professions program, but schools are interested in whether or not you will be a good healthcare professional, not just a smart one. The activities you are involved in and what you learn from them will be how the individual programs get to know you. The following slides focus on the activities that health professions schools expect you to be involved in to prepare for a profession in that field. Volunteer service is one of the most important activities you should be involved in. Your service can be done in a variety of different settings and does not have to be medically related. But you should be involved in things that are meaningful to you. You should also seek out activities that take you out of your comfort zone. Many students in Utah are religious and regularly participate in service through their church. But if all of your service is through church-related activities, you do not show a willingness to work with all different backgrounds or willingness to step outside of your comfort zone. While you will probably have a few experiences that last a day or two here and there, you should have at least 2 or 3 groups you volunteer with that you make a long-term commitment to. That commitment should be at least 6 months or more. You should be continually dedicated to serve during each academic year. Leadership can be gained in a variety of different ways. You may have a supervisory position at work, or you may choose to be involved with clubs on campus or student government. Leadership can take place at work, school, or church. Past experiences, as well as current or future experiences, are applicable. Healthcare experience is how you demonstrate your understanding of the medical field and show that you understand the rewards and difficulties related to caring for patients. If you are not comfortable being around people who are sick, you are not likely to be happy as a healthcare professional. Time spent shadowing professionals, as well as time spent directly interacting with patients, will be vital to your application. Research is not required for all healthcare professions, but it will always look favorable. You can do research in any setting, including biology, chemistry, behavioral science, exercise science, or business, to name a few. Most undergraduate students will get research experience by working with their professors as a research assistant. Many of your professors are involved in researching their own hypotheses and will invite students to assist them. You can also develop your own hypothesis based on a project and ask a faculty member to supervise your research. There are many internships available across the country, typically during the summer, for students to gain this type of experience. Research is not just writing a paper in your English class. Research expected by health professions programs is separate and independent from a class assignment. It is recommended that you have at least 50 hours of research experience. Plan on spending 1 to 2 semesters doing research. If you are planning to apply to MD medical schools, research is required. Almost all students being accepted to MD schools have some research experience. DO medical schools do not require research. However, it is strongly recommended. Older dental schools typically have a strong research focus, whereas the newer schools are less concerned about the research, but look at it favorably. PT schools have changed quite a bit over the past several years. PT used to be a master's level program, but physical therapists are working towards becoming more autonomous. They would like patients to come see them without having to wait for a referral from their physician. Because of this, most PT schools are now 3-year doctoral level programs and have a greater emphasis on research. Having research experience will be a great way to set yourself apart. When you look at websites and requirements for most health profession schools, they usually do not give specific information on what activities you should participate in or how many hours you should have in each. And while there is some crossover, it is not recommended to use one activity to cover more than one area. For example, if you volunteer in the ER of a hospital, it should count as patient contact or volunteer experience, but not both. Each activity area should stand on its own. Health professions schools will see the crossover when you apply. But in order to ensure you are creating the strongest application possible, it is strongly recommended that you diversify your experiences by not double dipping. One of the most important things you can take away from this orientation is that it is always about what you learned, not what you did. There are many things you can become involved in that will sound impressive, but if you do not learn from the experience, it will not benefit you or your application. Activities can be and should be simple and straightforward as long as you are learning about yourself, how to interact or relate to others, or the world around you. There are many different resources you can use to complete the activities. This slide lists some of those resources. You are most likely involved in a variety of different activities, and they may not all fall into one of the activity areas we have discussed. However, many of these activities will also be applicable to your application to health profession schools, even if they do not fit into one of the specific areas. While you are probably a couple of years or more away from applying to health profession schools, there are some things you should be aware of early. The following slides provide some basic information about the application process. The admissions tests required by most health profession schools are not easy and should not be underestimated. Plan on studying 4 to 10 hours a week for 6 months before taking the test. There are different ways to prepare, including prep books and prep courses. Most of these tests assume that you have completed all or almost all of the prerequisite courses before you take it. You will not be prepared to take the MCAT, DAT, PCAT, or OAT if you have not completed organic chemistry. There will be more discussion on how to best prepare as you get closer to application. Many health profession schools try to fill their class as quickly as possible. Your application can be seriously disadvantaged if you do not complete it early, so you can interview in late summer or early fall. For example, dental schools accept the majority of their classes by December 1st. If you have waited until October or November to submit your application, it will not have been reviewed by the time the majority of the class is filled. You may be one of the thousands students being considered for the last 20 or so seats. Be prepared to apply early. The majority of health profession schools utilize a central application service. The central application is typically referred to as your primary application. The primary application consists of your personal statement, course lists, transcripts, extracurricular activities, demographic information, and sometimes your letters of recommendation. This slide and the following slide list the names of the central applications for each health professions. Chiropractic and occupational therapy are the only professions that do not use a service like this. The application process takes about 1 year. You will begin applying to health profession schools about 1 year prior to your expected start date. So if you plan to begin school in fall of 2011, you will need to apply during the summer of 2010. In addition to taking classes and continuing with your extracurricular activities, you will be working on studying for the admissions test, requesting your letters of recommendation, and working on your personal statement. Application workshops put on by the Pre-Health Professions Office will also take place during spring semester. You are encouraged to take the admissions test early in the summer and submit your applications no later than midsummer. In the fall, you will be traveling to the individual schools that have invited you for interviews. The majority of students know their final status of rejected or accepted between the months of October and March. It is important to begin compiling a list of health profession schools you would be interested in attending to ensure that you will be best prepared for your top choice schools. It is recommended that you have a list of about 5 schools that you are preparing for. For those of you interested in medical school, you should be familiar with the similarities and differences of MD and DO medical schools. MD schools are the traditional schools that most people are familiar with. University of Utah School of Medicine is an MD school. DO schools, or osteopathic medical schools, educate students in a similar fashion, and osteopathic school graduates practice the full spectrum of medical care just like an MD physician. The biggest difference is the philosophy of osteopathic medicine. DO medicine emphasizes holistic care and preventative medicine, as well as a hands-on approach to diagnosis and treatment called osteopathic manipulative medicine. No matter which type of medical school you plan to attend, It is important that you are familiar with both approaches. For all health professions schools, it is important that you consider cost, curriculum, and location when looking at schools. Public schools will typically favor residents of their states, making it more difficult to be accepted if you are a non-resident, while private institutions will be more expensive, but usually will not have residency restrictions. This slide lists some of the people you may be asking for a letter of recommendation. You will not be requesting letters of recommendation until the spring prior to your application because letters should be current with the application. However, during the next year or more, as you complete your prerequisite courses and prepare to apply to health professions schools, you should build a rapport with your professors and supervisors in your various courses and experiences. You may not need to request letters from all of these people, but it will help you to have multiple people you can go to in order to get excellent recommendations. If you have family members such as uncles, brothers, sisters, fathers, cousins, etc., who work in the field you are interested in pursuing, take the opportunity to shadow them, but when the time comes for application, family members should not be writing you a letter of recommendation. Be sure to diversify your shadowing experience by shadowing other professionals who will be able to provide an objective recommendation of you. Many health professions schools will not accept letters of recommendation from family members, and even if they do, it will not benefit your application. Paying for the application process for health professions programs is not something to worry about right now, but you should be aware that the process is time-consuming and can be very expensive. You should be aware of the costs in advance. This slide is informational only, and costs are subject to change. While we have discussed a number of different topics, and it may seem a bit overwhelming, there are certain things that should be among your top priorities. You don't need to do everything right now. Just start taking steps forward. Prepare to enroll in prerequisite classes. Instructions on how to schedule an appointment with the pre-health advisor are on the following slides. The pre-health advisor can help you plan out an appropriate schedule for taking these classes. Also start looking for volunteer opportunities. Because it is important to show dedication over time to serving others, volunteering is one of the first things you should be doing. Be sure to track your experiences by journal or Excel spreadsheet. Find a tracking method that works best for you. Include the number of hours you spend, the start and end dates, contact information, and what you did. Due to the number of students the pre-health advisor meets with, there are certain policies in place regarding scheduling appointments. Please be aware of these policies. Appointments are scheduled by phone. Call 801-863-8425 to schedule. Same-day appointments are not available. You have now completed the online orientation.